All right, thank you for being here today. I will be discussing how you should disseminate your work to new audiences by developing an online presence. My name is Dr. Heather Gilmartin, and I am the Associate Director of the Colorado Clinical and Translational Sciences Institute Dissemination and Implementation Research Core. I'm also a Clinical Associate Professor at the Colorado School of Public Health and a Research Health Scientist at the Rocky Mountain Regional VA Medical Center. I'll start today with discussing why you should actively disseminate your work. I'll then introduce some dissemination and implementation resources to guide your efforts, including free personal profile sites, visual abstracts, infographics, and more. And then at the end of the session, I hope I've sold you on the idea of dissemination and that you are ready to build out some online profiles. So I'm going to start with a question. How long do you think it takes, on average, for research to benefit patients or communities? And let's not even talk about the time it takes to write the grant, get it funded, do the work, then get it published. Let's just focus on how long does it take for something that is ready to be out on the market or ready to be put into practice? How long does that take? So a frequently cited statistic is that it takes, on average, 17 years for research evidence to reach clinical practice. And there are many factors that contribute to this time lag. One factor is that many researchers actually think that their job ends when they publish their work. They then move on to the new discovery with little attention on how to apply their findings in the real world. And this is true for quality improvement folks as well, right? They implement in one setting and then they move on to another challenge, even though there are other organizations who could benefit from the knowledge. We have a responsibility to ensure the science we develop and implement reaches patients and communities as soon as possible to realize positive impacts. So where can you start? You can start with designing your work for dissemination. So it's not something you tackle at the end. It's something you're thinking about all along. Dissemination is an active, tailored process of communication that is meant to spread information widely. This is different than implementation, which is when users learn about and start to use an innovation. This is also different than diffusion, which is a passive process by which an innovation is communicated through channels over time. There are two approaches to scientific dissemination. One is by using theory-guided models or frameworks to organize and outline your approach to ensure sustainability, equity, and impact. The other one is a passive hope and pray approach, which looks like publishing a paper or giving a presentation, then hoping someone will hear about it, which is where almost 75% of researchers are. But we're going to start changing that today with this presentation. So what we're going to do is we're going to get you started towards active dissemination of your scientific products or innovations. First, though, you may be thinking, isn't publication enough? I mean, that's how it's always been done. The bedrock of scientific dissemination is to publish your quality improvement or research in peer-reviewed academic journals. The good news is there are so many to choose from. As of 2020, there were over 46,000 academic journals publishing papers worldwide. And really, over the last 10 years, the number of journals has grown at an average rate of 2.5% every year. This has resulted in at least 64 million academic papers being published since 1996. An astonishing 5.1 million articles were published in 2022 alone. This is a good thing because people are getting their science out there, but it's a bad thing because no one has time to keep up with the literature. This figure shows the average number of articles reportedly read per year by university faculty members from 1977 to 2018. In 2005, this group read about 275 articles a year, and then it went into a steady decline. I mean, Most academics you talk to do not read beyond the abstract of an article. I could not find any data on reading of publicly available reports, but I do know that leaders in government and in healthcare will read a one-page executive summary, especially if there are pictures, but a lengthy report, probably not. So, how do you make your publication stand out? How do you get a fellow clinician, academic, funder, or community member to know about your work? Best practice is to think about who you want to know about your work, right? Who is your audience? Where are they? Are they online? Do they read newspapers? Do they listen to radio? And then how best to get the content to them? These are your engagement partners who can help you get the word out. If you wait until your report or paper is ready for print, you may not have the energy, the money, or the team to do this. Lucky for you, there are many free dissemination resources out there to guide your design efforts. So at my last count, there were over 100 dissemination theories or models for you to choose from, which is a lot. Fortunately, there are very smart people out there trying to make this work easier, including folks here at the University of Colorado. This group created the Dissemination and Implementation Models in Health Research and Practice web tool. The interactive web tool will show you all the dissemination models currently part of the peer-reviewed literature. Or you can select from a list that these national experts recommend. Once you find one that seems like a good fit, you can learn about how the model has been applied in different populations and different settings and find measures associated with the model. And the authors have tutorials to help you navigate the website since it is quite large. So the most used dissemination theory to date is the diffusion of innovation. In 1962, E.M. Rogers published a book called Diffusion of Innovations, where he sought to explain how, over a period of time, an idea or product gains momentum and diffuses or spreads through a targeted population. Through his research, Rogers discovered that the adoption of new ideas was a process, one in which some people are more likely to adopt new ideas easier or faster than others. As a result, 5 adopter categories were identified: innovators, early adopters, early majority, late majority, and then the laggards. In our work, we are often the innovators, right? Through reports, manuscripts, and presentations, we diffuse our work to early adopters, those who like new, shiny things. To cross the chasm, right, and reach the early and late majority, though, we need to actively disseminate our work. Who lives in this group, right? These are your administrators, your policymakers, and the public. Another commonly used dissemination theory is from the world of marketing. This one is called social marketing theory. Social marketing applies marketing principles to societal objectives, such as improving the health and welfare of individuals and society, rather than corporate objectives. This theory guides the user to design their dissemination strategy based on 4 Ps: product, price, place, and promotion. Product refers to the research findings being disseminated. The way you package and present your research findings should be designed by and for your audience, who know their local context. Price refers to the cost in time and money to your audience for seeing your product. If your research findings are behind a paywall or require multiple steps to access, this is a limiting factor. Place is how your target audience receives and accesses your research findings. The ideal is for audiences to invest minimal effort to retrieve product information. Ideally, your work arrives in their inbox or social media feed and catches their eye. The last P is promotion, which guides you to consider the different methods of communication. And these range from low-touch methods such as social media, radio, and internet messages, which subliminally promote your work without people knowing they're being influenced. High-touch methods include hanging posters, attending community forums, distributing printed materials. These allow for face-to-face interaction, but limit how many people you can reach. If you're thinking, wow, this is a lot, don't worry. There are many people working to make dissemination guidance more accessible. The Designing for Dissemination and Sustainability Action Planner is a new interactive tool you can use to help engage partners through a planning process to maximize the impact of your work. I use this as I'm writing a grant or talking to partners about a new project to ensure that our intervention solves a problem and fits the context in which it is intended to be adopted. So one more resource is the CCTSI Dissemination Consult Service, which we started in 2020 to build dissemination capacity for CCTSI members who work across the clinical and translational spectrum. We work with basic scientists, health services researchers, and quality improvement experts. They come to us when they are writing dissemination plans for a grant, when they want to study logo or graphics, or when they are ready to share their findings. We also have a fee-for-service program where you can pay us to manage your dissemination work, create messaging graphics, and execute dissemination strategies such as a social media campaign. So if you are interested, go to the CCTSI webpage and you can request a consult, which is free. So during our consults, we follow an evidence-based dissemination planning workbook, which is guided by the diffusion of innovation and social marketing theories. This open access resource is available to you on the CCTSI website. When you design your project for dissemination, you engage your shareholders and collaborators early. You synthesize their impact statement, and also create or really edit your value proposition, and then you budget appropriately for things like graphics and videos. Your dissemination approach may change over the course of the project, but doing all of this work up front is a very beneficial exercise. So once you have a theoretically guided dissemination plan, you should think about developing an online presence. For what happens when people start to learn about your science? They are most likely going to check you out, right, to determine if you're a credible source. So by developing an online presence that you manage, you can ensure that when people go looking for you, they find an academic researcher, right? Not your side gig on Etsy, which is fine if that's also what you want them to find. But there are multiple benefits as an academic researcher or quality improvement professional to have an online presence. The personal benefits include it allows you to distinguish yourself from other clinicians, scientists, and researchers, especially if you share a name with others in your field or your name is tricky to spell. To automatically link your professional activities and publications to yourself allows you to maintain control over what is linked to your name. And then also it will facilitate collaboration. And it does make it easier to assess the impact of your work for grants, reports, or promotion. The professional benefits of creating an online profile include that your work is more likely to be found, read, discussed, and shared online, which is how most people find out about scientific and health innovations. You can connect with collaborators across the world who might be interested in taking your science into their setting. And you can engage in scholarly discussions to see if your work could be better or done differently. And you can find jobs or speaking engagements and even consultant opportunities. So the first thing to do is to sign up for an Open Researcher and Contributor ID, or ORC-ID. ORC-ID provides a persistent digital identifier that you own and control, and that distinguishes you from every other person out there. You can connect your ID with your professional information, so your affiliations, grants, publications, peer review, and more. You can use your ID to share your information with other systems, right? Ensuring you get recognition for all your contributions, saving you time and hassle, and reducing the risk of errors. Many journals now require an ORC-ID when submitting to make sure information is correct every time. It is a simple sign-up process. You go to orcid.org and you fill out as much or as little as you like, then review it once a year to make sure it represents your body of work. I use my annual review time as my reminder to update my online profiles. So the next thing we suggest is for people to create a Google Scholar profile. So Google Scholar profiles are a simple way for authors to showcase their publications. You can check who is citing your articles, graph citations over time, and compute several citation metrics. I've included a screenshot of my user profile, and once you click on that, you'll see all my work, which can be sorted by title, year, and number of citations for each publication. The other cool thing is the calculation of a platform-dependent H-index to track the impact of your research, which is the graph on the slide. And this is helpful when you ask people to write you letters of recommendation, plus when you're submitting your annual review or a tenure packet. Plus, when someone Googles you, such as your peers, journalists, funders, or community partners, data from your Google Scholar profile will pop up. And then if you are faculty at the university, consider building out your Colorado Profiles webpage and other professional profiles hosted by your department or your school, and make sure it's up to date, right? So Colorado Profiles is a program offered by the Colorado Clinical and Translational Sciences Institute, and it gives you credibility as an academic scientist. So I've grabbed my profile as an example, and I use this as my professional website, right? And I send people to it to grab my headshot or a bio for conferences or publications. Okay, so now that you have an online profile that you can control, it's time to find your people. So why should we all be participating in online scholarly communities? Because it helps us stay up to date on news and publications in our field. It can increase the visibility of our work and stay connected to the field. It can help us engage with colleagues and establish our expertise in our subject area. And it can help us develop a platform to disseminate our work to colleagues and the general public. We encourage everyone to do this before they have something to share, because you need to build your audience. And there are a lot of scholarly communities out there, and they all have benefits and drawbacks, right? If you're a Twitter person, an X person, if you're an Instagram, if you're a TikTok, if you're a Facebook, if you're a LinkedIn, it really depends on what you want to get out there and to whom. What we recommend is that you tailor your platform to where your audience is. So social media is great, right? But if your audience is not on Twitter X, then put your energy somewhere else. Perhaps they read newsletters, right? Perhaps they listen to podcasts. Perhaps they listen to local radio, or they drive by billboards, right? It really, crafting your dissemination platform and to the audience you're trying to capture is a very, very important step. So we do encourage you to look at social media platforms where your audience lives. You can create a profile, or if you don't want to be personally on there, your lab can create a profile, or your department or your university. You send information to your department communications people, and they will share it on social media for you. You know, whatever you are comfortable with. Remember, though, that you should include a link to your personal profile, right? So people can reach out if they want to learn more, so they can easily find you. But this is just the tip of the dissemination pyramid. We also encourage you to submit your work to online news outlets such as the New York Times Upshot or The Conversation to help your subject area get national exposure. Blogging and being a guest on a podcast are other options to share your work with new audiences. All of this work is based on, of course, your published peer-reviewed literature, for that is the bedrock of our scientific endeavors. Okay, you have a professional online profile now. You are thinking about the communication pathways you could share your work. Let's end with a bit of information about how to create visually engaging materials to share online or through presentations and on social media. So I'm going to talk about visual abstracts, infographics, and some videos. So a visual abstract is a visual summary of the key findings of a study, report, or publication. Like the executive summary section of a report, it conveys the most essential points in a shorter format. It does not replace reading the full article. It serves to generate reader interest. A visual abstract can be built in PowerPoint, and there are toolkits that can teach you or a member of your staff to do this without too much effort. They're great to share on social media. Plus, I've seen them used in presentations and as posters. I recommend going to Dr. Andrew Ibrahim's website, who was a creator of the visual abstract. He publishes an open source primer at a surgeon's journey through research and design. So if you have some talented staff or funding to take your graphics to the next level, you can create an infographic about your work. So infographics can present complex scientific information at a level that diverse audiences can understand. These can boost engagement and provide entry-level education about your work. They also look great on social media, in a newsletter or blog, and might be picked up by news outlets. So there are software programs such as Canva or Adobe Creative Cloud you can use to create these, or you can work with graphic designers locally or online. I've contracted with designers on 2 different platforms. One is called Fiverr, and the other one is Upwork. And if you have an idea and your messaging outlined, they will create incredible things for you at a pretty low cost. Last, I want to have you think about creating videos about your work. So videos require design help, but they can be an effective dissemination method that can break down complex topics into language and visuals that pretty much anyone can understand. One of my favorites is an explainer video by Dr. Aaron Carroll, who writes the Incidental Economist blog. He does a great job of explaining why you should actively disseminate your work. And I highly encourage you to watch this video and share it broadly with those who have not heard this presentation. So in summary, today I reviewed why you should actively disseminate your work. I presented dissemination tools and frameworks to help you guide your work. Last, we discussed how to develop an online presence, engage in online communities, and create engaging visuals. You all now can get started, right? Sharing your work with new audiences. It's a big world, and people need to know about your science. So community, society, and policies can be positively impacted. And just as a reminder, the CCTSI Dissemination Consult Service is here to help. If you are thinking, I'm not even sure where to start, or I have an idea, but I want to make it better, ask for a free consultation. You go to our CCTSI webpage, you look for the Dissemination Implementation page, and you can submit an application. We look forward to hearing from you. Thank you for spending this time with me.